When a person engages with an AOD service or clinician for support to manage substance withdrawals, we will first take some time to discuss what this might look like to them and how we are able to assist them in this period. I would explain that there will be a lengthy assessment process involving lots of questions about their substance use, about their physical and mental health. There will be questions about their family, their lifestyle, their goals post-withdrawal, and we'll likely need to perform some physical assessments like an ECG to look at their heart, maybe their blood pressure, urine, and maybe some blood tests. All of this will be to ensure that we provide the right level of support for them, to ensure that the withdrawal process is as comfortable and as safe as possible. And because of this, it is really important that the client provides accurate answers to our questions.
In the initial stage of planning, it's important to provide the person the opportunity to ask as many questions as they need and provide as much information as possible so they can make an informed decision. Withdrawal is different for everyone. What worked for me might not work for someone else. As a peer worker, I'd supported many people to change their relationship with substances. It's important when supporting someone who is preparing to withdraw from a substance to understand what their goal is. It could be abstinence from problematic substances, or it could be to reduce use.
A significant reduction in a person's substance use is still likely to result in withdrawal symptoms and require a degree of support. We can support people with either a tapering regime to reduce or cease their use, or manage withdrawals after a complete cessation of one or more substances.
Some services and clinicians may prescribe medication to assist withdrawal. Before prescribing medications, it's important to understand the person's current relationship and history with prescription medication. Is it safe for the individual to use these medications during the withdrawal period, or could this cause further problems? For me, I choose not to use opioid pain medications. I have a history with heroin, and I have a genuine concern that opioid medications could be problematic for me.
I would also let the client know that we would talk to them about what they might expect to experience in the withdrawal phase.
Possible symptoms, how long they'll last, and how can they manage physical pain and mental distress.
Clients will be given advice about possible treatment settings for their withdrawal management. The setting will be guided somewhat by the outcome of the assessment. However, clients do have some choices about what might suit them best. The level of support a person has from family and/or friends will also have some determination on the setting.
If the person chooses to withdraw at home, do they have a supportive network in place? Do they have access to a supportive family, a partner, or a professional support? Do these supports understand the substance and the withdrawal process the person is about to go through?
This is also a good time to discuss confidentiality and who the client may want to be involved in their treatment, and how we can also give them information to help support the client.
It's also important to acknowledge that a lapse or a relapse can happen during a withdrawal period. A supportive environment doesn't frame a relapse as a failure, but encourages the person to review their goals and re-engage in treatment if that is their decision. During a home withdrawal, the person may decide to attend a community service, such as a day rehab or an outpatient withdrawal service. It's important to identify if they have access to regular transport. Will they be capable of driving themselves? Can they afford public transport to get them to their appointment and home? It's also important to discuss and plan the intended route of travel. This may help to avoid areas they frequent when using or getting on, and avoid people they may have identified that could be potentially unhelpful. If the person is considering attending a residential rehab, discuss what would be the cost of rehab, not just the financial cost. Consideration needs to be made towards their current accommodation, cost of living, and employment. These are all important considerations that should be discussed with the individual in the withdrawal planning stage to help them decide what option best suits their circumstances and goal.
Clients need to know that managing withdrawal is only the first step in their change journey, and that we will be here to assist them along the way.